Hello, everyone. Welcome back to the All Mercy podcast. Wherever you're tuning from, or wherever you will be tuning from, we say hello. The whole crew here says hello, and thank you for tuning in. Thank you for watching this. Today, we are talking about a very sensitive topic. We're talking about conversations that matter for your mind, your body, your spirit. Again, I'm your host, Mercy Gesang, and today, again, let's dive into the topic that touches so many lives: addiction. Addiction is not just a substance, it's about people, real people, it's about their families, and it's also about the journey of healing. We have a special guest here today who will help bridge that from family practice, hospital medicine, and psychiatry. Let us explore the challenges that link physical and practical advice for those juggling multiple roles and encourage everyone that is in that journey of addiction. We have none other than Immaculate Come. Please, can you introduce yourself, Immaculate, and welcome. Thank you for making the time to the All Mercy podcast today.
Thank you so much for this privilege to be part of your podcast. Actually, when I came across your podcast, I was so much filled with this kind of joy because I imagine how many lives have been touched, and I really want to thank you for giving yourself to the service of humanity to this extent. You are
Oh,
really changing lives. Yeah, the impact is so real. God bless you.
thank you. Thank you for acknowledging that. God bless you too. And I don't want to undermine what you do as well. So thank you for that. So, can you start by introducing yourself and telling us a little bit about what you do and what inspired your journey as the CEO of that one? Can you start by introducing yourself and just tell us a little bit about what you do and who are you?
So I am a family nurse practitioner, and
How did I
I
do that?
have worked in several backgrounds.
Let's
I'm a
see.
hospitalist. I have also worked in urgent care during the pandemic. I have also done post care, and I have seen a broad spectrum. Can you hear me?
I hear you very well.
Okay, thank you. So, in all this scope, I have been able to work with various specialties, and I really appreciate the integration of all the specialties that come to ensure that
I
our
think we are
patients
having,
are
yeah, I think
connected.
we are having a little technical difficulties. You're a little bit frozen.
Mm,
Let's see. Let's.
Maybe I should, yeah, I've been feeling that something is not right, but I don't know what it is.
Let's see.
Can you
Maybe
hear
log
me?
out and I hear you very well. We hear you very well. Maybe log out and come back in.
Okay, let me try this.
Yeah, try to log out and come back in. Let's see. Again, I want to welcome all of you to the All Mercy podcast today, where we have these open conversations that will impact lives, it will impact families, it will impact the minds towards recovery. Not only that, addiction can be a very sensitive topics that people don't talk about. The fact that we don't talk about it as much as we should doesn't mean that it is not existing. And the fact that we don't talk about it doesn't negate how it is destroying society. So it is a topic that does not just affect the mind, and it doesn't just affect the individual. When one person is impacted by it, when one person is affected by it, when one person is addicted to something, it affects the whole family, the loved ones, friends, even the community, because it starts with that one to expand to the next person and the next person. In mental health, when we talk about addiction, we're not just talking about substances. Most of us are addicted to things that we don't even know, to some ideas that we don't even know. You can find people who are addicted to worry, who are addicted to sadness, who are addicted to other things, and they do not know how to break free from that. Talking about it, it is one step towards healing. Talking about it, it means that we are addressing something one at a time. It takes one person to heal for the other person to heal as well. It doesn't mean that we are looking bad at those who are addicted. It means that we are sending a helping hand out there to say we see you, we hear you, you are not alone. We are here for you. We as a practice, we as a community, we as your loved ones, we are here for you and we will always be here for you. Whatever it is that you're struggling with, whatever it is that you're addicted towards, whatever challenge is pushing you towards that addiction, you're not stuck. There is healing on the other side. Are you ready for it? Sometimes some people feel like, oh no, it's too much. I've tried several times. I keep relapsing. I keep relapsing. Don't give up. There's healing at the end of the tunnel. Even when you relapse, remember it's relapse. Relapse means that you were fine before. You just went down again. You just stumbled again. You can do it again. You can recover again. And guess what? You are never alone. Come what may, you are never alone. We want to say together, let us explore what is linking you to that addiction. Even if it is not a substance, I want everyone to be open minded. What are you addicted to? Is it to food? Is it to your job? Is it to something? What is addiction, by the way? When we talk about addiction, what are we talking about? Doing something too much that it almost makes you non functional. Doing something to the point that that thing has control over you. It looks like our guest is coming back. Let's see if we can bring her in. Wherever you are in that journey with addiction, with recovery, with relapse, wherever you are in that journey, you are not judged. And please don't judge yourself. We are here to take the wheels, as we always say, and ride well together. Let's see if our guest is, let's see. Is that better now?
Yes, I just changed device.
All right. Let's see. Yeah, I was saying, can you introduce yourself and tell us a little bit about what you do and what inspired your journey from internal medicine to family practice and now towards psychiatry?
Okay, so actually, I have I have worked in like a hospitalist and a post-acute provider for a time. I had also worked as at the urgent care. So I have this broad spectrum. I've met patients of all ages. You know, when you have like a family medicine in within your scope of practice, you're
Mhm.
able to see from 18 months old till end of life. So at the urgent care, I was able to see um, all populations. At the post-acute, also, most of them were mostly geriatrics, but in the
Mhm.
hospital, I round in the pediatric campus and also in the adult campus. And so I have had the experience of working in all of this fair. And one of the things that really, you know, made me feel so fulfilled is when I took up the role as the sole provider over the weekend
Mm.
for rehab. You know, there you have all the acute crazy conditions and you're by yourself. And at that time, if you have to get psych consult, it's until Wednesday. And so it had to make me work. It had to make
Why
me,
Wednesday? Wednesday was the only day that the psychiatry will come.
yes.
Okay.
And so all this, by the weekend, you are the only hope that they have. And that, as challenging as it was, it actually helped to give me a broad scope of experience and made me able to enter into one or two things and appreciate other specialties.
Mm-hmm.
Mhm.
What I want to ask this: what lessons have stuck with you the most?
One of the things that have stuck with me the most is that with my knowledge of internal medicine and every post-acute everything else, one thing that has stuck with me is that healing begins from the mind.
Oh,
It doesn't matter whether you have a broken bone or your electrolytes are out of the whack or you have cancer or you have whatever you have, or kidney injury or you have heart failure, whatever you have, healing begins from the mind.
I'm glad you say that because it's something that I believe strongly myself. I believe that strongly myself. I don't care what facade you show out there. I don't care what the outside looks like. If the mind is not there, if the mind is not stable, guess what? It will start showing in the physical very soon, sooner or later, it will start showing. And healing is more internal than it is outside. That's why sometimes you can just look at somebody, the way they feel, the way they you can tell from their mood that something is going on. So, but I want to thank you for all that you do,
You're welcome.
all the different phases,
Mhm.
taking care of patients bravely, and now integrating psychiatry into it so that you can provide that holistic care. How wonderful is that? And I think that most people will benefit from your services. Thank you so much. And
Yeah.
that leads to this question: how has your diverse clinical background shaped the way you view patient care today? Because I know that patient care from the last 5 years, maybe it has been different today. How has that been different?
So, trailing back to the COVID era, I had the opportunity to work in both the post-acute and the urgent care,
Mhm.
and I saw firsthand the weight of the pandemic on people, the fear, being trapped. Will I leave now that I am positive? And so
Did
that
you got the COVID?
no, I'm talking about the
Other people,
patients.
okay.
Yeah, I'm
Mhm.
just giving a synopsis of what was going around.
Right.
That plane, that flight has to be canceled. You just tested positive. How do you help people who feel like a loss? Some have already lost loved ones and now they are positive. They are afraid they were going to also die. And then you have to start with this education. Once they test positive, one of the most important thing that have come through with me is when you are able to have that time, that one-on-one time to educate a patient, to give them direction, to break through that ominous news they are giving them and tell them there is hope. Do this, do it this way, keep yourself hydrated to keep down the viral load, and then avoid stress, get more rest, and then you will be fine. Now, look at what happens. Stress breaks the immune system.
Yep.
Now you see how the mind and the emotion plays in every sickness, no matter where you are. So now, when you get that, the first thing you want to do is that calm assurance and that positive therapeutic counseling that helps that patient navigate that condition, that medical condition. And that is where you always see that at the end of the day, you still have psychiatry coming in.
Yes.
When many people think of psych, they just think of someone that is maybe having one delusion or psychosis. No, psychiatry is mental wholeness.
Mhm.
Every one of us have a psychology. Every one of us have a mind. Every one of us have a state of our psychosocial status that can be either dysfunctional or functional. At that time, your mind needs some settling, and that's where psychiatry comes in. That's why I am so much appreciative of psychiatric medicine, and I will never hesitate to hit that text to psych. I need you to see this patient. I have already gotten this started, from a general perspective, but please follow up with my patient, because I know that for me to get the outcome I need to get that woman with a broken leg to start to take steps to do therapy, I have to start by, first of all, assuring her, getting her out of the mindset of defeat. And that is where you realize now that mental health is invaluable. It affects everything.
Thank you for saying that. You said something that I picked on very clearly. Everyone has a mind. And because everyone has a mind, sometimes we are able to condition our mindset to stay stable. And sometimes, no matter what we do, external factors, internal factors, genetics, environment, and all the other things can affect our minds. And yes, if you're a living thing with a mind, you're prone to have sometimes some mental instability. I think the word mental just makes it heavy that people don't even want to talk about it. What is mental? It is your mind. Do you have a mind? Yes. Then why don't you want to look at the mental side of it? Is my mind healthy? You talk about the woman with a broken leg. Okay, her leg is broken. Maybe she's not able to walk. Maybe she's not able to walk. Maybe she's not able to be a mother or that person that she was again in her family. All the psychosocial stressors kick in just from that. And I'm glad that when you're treating that woman, you're not only looking at that broken leg, you're looking at a whole component of somebody who is physically broken in one area, but what else can be emotionally broken. So thank you for doing that. That is holistic care. When someone come in with a broken leg, with a bad eyesight, can we also look at the deeper meaning, what they are going through, and what does that situation or that condition mean for them? How are they handling it? So thank you for that. But doing all this, I know that you are facing some challenges. It's not easy. So what challenges have you faced in bridging physical and mental health in your practice? Because I know I always say that what is health without mental health? And again, mental health is physical health. What challenges have you seen as you're bridging that two or integrating those two together?
So the thing is, looking at all this, you just said you're only as healthy as your mind.
Mm-hmm.
And I have not, like, let me just say, in the post-acute scenario, I have the psych unit and I have the regular unit. And so I didn't have any difficulty integrating both, because it's like you can't do without oxygen. You need it. And then another thing is that it is a necessity.
Mm-hmm.
Okay, so the only thing that got me want to dig deeper is the delay in getting these patients to see that specialty. If I want my patient to see a cardiologist now, bam, I get them. I want a neurologist. Neurologists still take time. Neurology is another area that it's on high demand, but
Mm-hmm.
you take time to get in. We need more
Mm-hmm.
people to pick up on neurology. If I want a pulmonologist, because they are already there. But when it comes to psychiatry, it looks like it's an area that wasn't given attention to.
Right.
And so what happens now is that you cannot even proceed as an with internal medicine. You can't even proceed if you don't pay attention to your patient's mental health.
Mm-mm.
So it is like you can run away from your shadow
Mm-mm.
because one, the you find, let me give a scenario like a patient who is having heart failure. They will always have anxiety because they are feeling this sense of doom is coming.
Yeah.
At least you should, even though it's not your specialty, you should go an extra mile and do a research to handle that transition anxiety so that you can be able to get the patient hemodynamically stable. Because when your patient is stressed, it doesn't matter what medications you're giving,
Nope.
they will not achieve hemodynamic stability.
Mm-mm.
So
Mm.
it's like, you can't, just like the head can say, I don't need the eye anymore.
You cannot say you don't need your mind anymore.
Right. So that is it. So for holistic care, for every provider who understands, every provider, at least you need to have a basic knowledge of psych.
Mm-hmm.
You cannot be in fact, if you're ignorant, it will be very difficult to even get your patient to be adherent to medications.
Mm-hmm.
Sometimes some of them are afraid of the medicine you're giving them, and the fear might be because of a past experience.
Right.
You have to address that in order to have breakthrough. So I can say nobody can escape sight, because at the end of the day, even you who
What? Let
fight.
me ask you this though. Why do you think it is more difficult to get that site to come see the patient? Number one, is it that the patient is hesitant, thinking that they will be diagnosed with a mental health issue, or the site is not just available at that time?
No, it's because we have limited providers.
Okay.
Like you could have one facility with just one site provider,
Hmm.
but you have multiple providers from internal medicine who are rounding every day of the week. But
Mm-hmm.
now the demand for psych is high, but the providers are few. So it is not in the patient's not wanting, because in as a provider, mostly in internal medicine, and you must be experiencing that, your patients believe in you.
Yes.
They believe in you, your recommendation, they want to go by it. If there is anything that patients obey, is the doctor's instruction. And if there is anything that is deep seated within them that they will share with nobody or even family members, they will share it with
Mm-hmm.
you if you connect with them. And so,
Mm-hmm.
as a provider, most of these patients, they when they see you walk into their room, they feel like a ray of hope came. Some of them have questions written on the paper because they don't want to miss out. And then when
Right.
you come, whatever you give as recommendation, when you talk to them, especially when you connect with them heart to heart, and when you're able to bring them in that place of mental assurance that
Yes.
it's going to be all right.
One
It's
big
going to
challenge that I have seen as well is, let's say, a patient who came in for with chest pain, right?
right.
And had a lot of anxiety, just like you talk about cardio issues, had a lot of anxiety. Am I gonna die? Am I having a heart attack? And things like that. Found out it wasn't chest pain, it was a panic attack. They are relieved that it is not chest pain, but they don't want to seek help for anxiety or for panic attack because it's a stigma. Oh, it will show that I will have mental issues. So thank God you're at the forefront to say, hey, no, let's seek a consult so that they can educate you on what is going on. Because sometimes it is not just a mind thing, sometimes it is what we are viewing or the stigma associated with someone saying that, oh, I don't just have a mental health issue, but I'm also addicted to something. I take these for my anxiety and I became addicted to that thing. For everyone going through addiction, please, 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 you are not being judged. It is a process, just like we will go through on any other thing. Look at addiction as a setback, and okay, how do we get out of there? And this leads me to this question: what advice can you give someone who feels overwhelmed, trying to juggle multiple roles and responsibilities in life? And sometimes we have seen that sometimes they depend on something or they become addicted to something to keep on going.
Oh, okay. So sorry, I was going watching on Facebook, so I thought you were still talking. Sorry about that.
That's okay. Mhm. That's okay.
Okay, so when it comes to someone being overwhelmed and maybe developing addictive tendencies,
Mhm.
have to first of all acknowledge why they are doing it. For example, in the post-acute scenario, I see a lot of people addicted to pain medicine, like opioids.
Mhm.
Okay, and then now what happens here is you when you want to help them out of that situation, one, you start by educating them. Two, you assess if they need a medical assisted
Mhm.
treatment, like maybe Suboxone, to come off of it, or you see if you can just taper them off.
Mhm.
So you start by assessing and evaluating the severity of the addiction,
Mhm.
you know, and generally we don't encourage people doing, like, for example, somebody can cold turkey. Some people may not understand cold turkey on
Right.
nicotine. Cold
Absolutely.
turkey means that you just abruptly stop and you use your willpower and just stop it. Mhm. So you can cold turkey on some addictions, but you can't do it on some because there are grave consequences. For
Mhm.
example, if somebody, cold turkey is an expression used that says you abruptly stopped and you had no consequences.
Mhm.
Mhm. So you now come to a place where you're able to identify what kind of addiction it is.
Yes.
And that person just quit by simple cognitive reframing. That way they can use their mind, use their will, and stop. Or does the person need medical assisted treatment to be able to come out of that situation? For example, I won't tell somebody, just abruptly stop using Xanax. You will have withdrawal effect.
You win them
uh,
all.
yeah, we will do taper off. And whenever you do taper off, you look for a non addictive and you do a substitute, because the truth in it is that person is not just taking it, they have a real situation.
Mhm.
So you face them with a lot of compassion and you guide them and take them out of it. And then
Is
for
it easy in your practice, in your care? Have you seen the transition being easy?
Okay, now it is variable, just like you
Yes.
say, care is individualistic.
Mhm.
Sometimes it's how you approach this patient that either makes it easy or difficult for them. Now, there is a way that they'll do intake. This now is in the hospital setting. Like I said, I was a hospitalist too. They will do intake and they will keep withhold some information because of stigma. But then when they are with you in that room and you just able, they are comfortable to bring their most vulnerable self, to
Mhm.
bring the most internal things that are mindful to them, they will tell you. Now, the way you handle that information will either empower them or will cause them to feel guilty and never
Right.
come out. You can never break free from addiction with guilt. So this is one of the things that you do. You start cognitive
I
framing
want
them.
to hold you there a little bit. You say you can never break free from addiction with guilt.
Mhm.
In the society that we live in, addiction is being judged. I have even seen providers judged people who are addicted. It is being judged, and sometimes that is why some people don't even seek the care that they need. I want to say, in your perspective, have you seen change over the years of how from seeing addiction as just a habit and recognize that it is a health condition and your perspective towards those vulnerable people? Have you seen change in that perspective from, let's say, earlier years in practice? Because some people will just say, oh, it's a habit. Oh, that's their choice. And do not even recognize the struggle that that person find themselves in, the condition that that person find themselves in. Has your perspective towards that changed at all?
So there is, I have this approach to life. I have what I call psychosocial needs that make up the data, and then
Yes.
people set it like
Yes.
a status quo.
Mm-hmm.
And I also have evidence based practice or rules
Mm-hmm.
that guide how I treat people in the society or
Mm-hmm.
how I help people in my practice. So I don't go with the societal myth because it's always very disinformative,
Mm-hmm.
because it's always very misguiding, you know. So when you decide to investigate, when you decide to research, when you decide to read a little bit further,
Yes.
you will understand. Like if I see someone come to me before I even got into the details of getting these things up, my first question is, what is going on in their in their physiology first?
Mm-hmm.
Because when I see a patient as an internal medicine, I first of all think physiology. What is the pathophysiology going on? Because sometimes someone may be having a mental derangement. Some people don't like this statement, derangement. For example, if you have kidney injury, you have your mind deranged. It feels like your brain is foggy. That's a mental
Absolutely.
derangement. So
Absolutely.
if I see that my patient is having that because of the kidney injury, what I do is a different path of treatment. But
Mm-hmm.
then another thing is, when you start to study, you start to not take those stigmas to paste it or plaster it on everyone. It helps you. Let me give you a very quick example. My daughter came back and said, Mom, I Googled and I saw that they put 30, 30 eggs of fruit flies and 100 grams of maggot in each ketchup and say hint. My next question was, it was a popular post. My next question was, I
Hmm,
think
I
you
didn't
need to
see that.
investigate that further, because that does not sound like an evidence-based feedback.
Mm-hmm.
And then we went back into it, and I started reasoning with her. I'm like, okay, now if all this ketchup we have, if they had to go count 30 eggs of fruit fly and do all of this, will we be able to have it? And what is the rationale? And then
Mm-hmm.
that's why she now went and said, Mama, it looks like it was just a fake
Post.
feedback. Okay, but tell me, how many people are not eating ketchup?
Because of that, right?
Right.
Because of
That is why we have to be mentally responsible. We have to be mentally responsible. And I think that a lot of providers have been made to take continuing education to help them take away that act of stigmatization where you're mentally responsible in
mm-hmm.
caring for your patients. And what about people being mentally responsible in the society? Don't just go around and say whatever you're saying, you're not even thinking of the impact. So, coming back to the addiction, I was saying that the moment somebody confides in you and say, this is what I'm struggling with, it's already a bold step. You have to consolidate that victory. You
Yeah.
have to make them wear the victory crown for taking that bold step to even desire to quit. And then you help them appreciate the fact that they have taken that step. Now,
Right.
the more you take your patient away from guilt to empowerment, the easy it is for them to be adherent to medication, and the easy it is for them to be adherent to psychotherapy, and then the easier it is for them to break free from that addiction in the arms of love.
You have said it all. The moment you take them away from guilt, to empowerment. They become more compliant, and not just compliant, they become even more hopeful
Yes.
that, okay, yes, I can do this. Someone believes in me. It gives them the encouragement, it gives them the support. And above all, they know they are not alone. Because in the past, early on, it is no lie that it feels like addiction was just about willpower. Like you can just stop whenever you want to. But when you work with patients, you will see that some of them really, really, and truly struggle. Sometimes it is just a brain disease influenced by stress, by trauma, and sometimes it is the environment. That's why you see some parents who move their kids from another environment. And sometimes also the truth it can be genetic. That's why even when we do the psychosocial evaluation, we ask for family history.
Yeah.
And we let them know because your father is an alcoholic, your grandparent, there's a strong family history. It doesn't mean that you will be one, but be
You are high
mindful.
risk.
Yeah, but be mindful that you are vulnerable and risky for that situation. So if that is the path that you want to take, be mindful that you may become addicted to it. Because recovery is not even about talking about their weakness as, oh, you are addicted, you're weak. Recovery is about talking about your strength. It's like you fall down and you're able to get up. It's about the treatment, it's about the support, even before the healing. It's about the inspiration and the empowerment, like you said, even before the healing. And this led me to ask you this: what myths or misconceptions about addiction do you wish more people could understand?
The misconception about addiction is that people want to be addicted.
Yeah.
And then the misconception about addiction is that the people are abusing substance, even though I know that that's a code.
Mm-hmm.
But now, there is, from my research and my interactions with patients who are struggling with addiction, just like in internal medicine, I
Mm-hmm.
manage patients who are struggling with diabetes and have been able to bring them to that stable place where you work with them. Sometimes you come, they have just decided not to even obey the dietary restrictions,
Yes.
and you will go with them from there. So addiction to a substance is the same like any other disease. And so this is the misconception.
Yes.
Like, for example, even though I consulted like internal medicine in the hospital, but I also allow my valuable insight from my well-read database to help my
Yes.
patients without
Yes.
hesitation.
Mm-hmm.
And so when I go to get a patient for consult, and I'm like, I'm glad you came to take me out of that room. I couldn't wait to run away. I just don't feel like being here. Good. When you do that, by the time I finish with you from my exam room, you're going back smiling. So the psychotherapist used to say, you've gone and taken your own joy, or your own dose of hope. Because one, you will come into my exam room and you'll be like trying to feel guilty, and I'll be like congratulating you for making it here. That's
Mm-hmm.
brave, and I hope you're really rewarding yourself by
Yeah.
patting yourself on the back and saying, I am
Oh,
on
they
my
need to hear that often. Yes.
yes.
They
And
need to
I'm
hear
like,
that often.
you
That's
are in the
that's the
right place.
empowerment you're talking about.
Mm-hmm.
That's the
And then I will
empowerment
be
you're
like,
talking about.
okay, now they'll still tell me their history. I've been abusing alcohol, I drink this and that, and I'm like, okay, now I want you to understand that alcohol is now abusing you.
Yes. Yes.
I'm like, I want you to realize that the alcohol has become a bully. It was first of all a partner. I'm like, when you took that first sip, it was for socialization, which is
Mm-hmm.
okay. But the alcohol came in and bullied you out of your master's bedroom and sent you to the garage without any mercy. And
No.
then you go through the cycle because you're the one that is paying for it under that abuse. You
Yes.
think that you're the one that wears the guilt. I'm like, from this day, I want you to wear the crown of someone who is up to break free from abuse. I
Yes.
say, you see how people break free from abusive partner? Now I want you to know that that alcohol is an abusive partner. The moment you see it like an abuser, you will stop guilting yourself and you'll be more strong to like, I brought you in and you took over. Now you're going out because I got the power. And I'm like, you have what it takes. And then that is the strongest cognitive reframing. And they'll be like, I never thought of it this way. Then
Yes.
I'll say, look at this. This alcohol is not only taking away your safety, your comfort, coming after your job, it is coming after your kidneys. You have had kidney injury because of alcohol. You may risk getting kidney transplant because of alcohol. It's
Because
not
of that.
just a friend to
Yes.
keep.
Yeah, absolutely.
Alcohol was a partner before, but now it's an abuser. I'm like, it's coming for your liver. You see, when you did exam, your hands were tremoring. Why? Alcohol is depleting your vitamin B
Uh-huh.
sources. And I'm like, okay, now this is it. You have the power, and we are here to support you. Keep this bully out of your life. And the liver
I'm
will go back
so
so empowered, you
it's
know.
very empowering and
Right.
inspiring as well. And it feels like just telling them that you've given them a tool to use, not just a tool to use, but you have redefined who they are. Your worth is not seen through alcohol. And if I have to go that route, I would say the most common misconception that a lot of people in the society have is that, oh, he's just a drug user, or he likes to get high, or he likes to get drunk. Maybe he likes the feeling that he gets from there. But can we dig down and see why does he like that feeling? What is that feeling masking for him? What is he hiding underneath that feeling? Because it's something that we just say, oh, they will stop if they wanted to. It feels like they keep taking it because they don't want to stop or because they want to take it. Sometimes the truth is that the way the brain pathways work, it goes around the reward that that feeling gives. And you forget that the feeling has hijacked you. Addiction is treatable. Some people think once an addict, always an addict. It is treatable. So please, let's use evidence based research, like you're saying, and with a lot of compassion and empowerment, we can support anyone going through whatever kind of addiction. And I said earlier that it affects one person, but it affects a whole bunch of people behind that person, which lead me to this question to you, dear. What role do family and community support play in helping someone recover from addiction? What do you think?
So when it comes to family and community, um, one of the ways that family and community can help is by, you know, being supportive, refraining from being enablers. Because sometimes,
Bingo.
yeah, sometimes,
Bingo.
mhm.
Refraining from being enablers. Oh, I love that.
So if someone is already struggling with something and you say, just take a little bit, the
Mhm.
problem is with this addiction, the brain has been remodeled. So going to get that alcohol, the muscle reflex to stop and drink
Yeah.
is now coming but from the brain, because alcohol, just like I used the metaphor of hijacking your master's bedroom, takes captures receptors in your brain
Mm-hmm.
and remote control you. And so now, when you have that going on, that is where we now come and like, if somebody's still at the stage where they can cold turkey and just abruptly stop, the cognitive reframing help. But we
Mm-hmm.
also have treatments like
Mm-hmm.
naltrexone and antabuse that we can assist them with. And then when it goes back now to family, because you have some patients who are struggling to quit an addiction, but they are going back to home with people who are still drinking, who are still smoking, and
Mm-hmm.
then it makes it hard for them. And so the family and community can help by identifying that this is a disease process.
Mm-hmm.
Just like you will not put too much salt in the food of someone having congestive heart failure, you should also have mercy not to just take your glass of wine and drink in front of someone who is struggling with
Who's
alcohol addiction
struggling, right?
and is struggling to get sober. You might not yet be in a place where you are addictive. Maybe you still have it under your belt, but have compassion on that person. And then when it
Mm-hmm.
comes to the community also, there are things that you know that are enabling, you know, easy access to these things, you know.
Right.
And another thing is, are there enough community engagement that can help people? Because, for example, someone might be maladaptively coping with alcohol
Right.
because they were not recreational immunities in their community. Like
Mm-hmm.
here, do you have parks? Do you have
AA.
walking trails? Do you have places that people can go?
Yes.
You
Yeah.
start to help them get community resources on
Mm-hmm.
what they can do to cope differently, you know, because someone might just be winding down because of stress from work. While we give that person the psychotherapy of giving them coping skills, when
Yeah.
you go back to the society, also to the community, let them have the community resources that help to fill in that gap so they can have something else to do than go to drink. And
I
then
think that
going
answers the question that I think that also answered the question that Joanna has. Why is this so important to have a community? And to add to that, I want to say family and community support. I mean, if someone was addicted, their family are the closest people that they know, their community are the closest people that they know as well. And that support makes a difference between relapse and recovery. When patients feel seen, when they feel loved, they feel supported, they feel empowered, like you said, they are more likely to stay engaged in treatment, especially when they don't feel judged. When they feel seen, heard, supported, empowered, and all that, they are more likely to stay in treatment. Support needs a lot. And like you say, we can always support without enabling. We can always support without enabling. And if I can ask you this, you already talk about faith-based support, different things in the communities that can support and so on. But have you seen that sometimes, like I said earlier, the people don't get treatment because of the stigma? How would you how would you address the stigma when people feel ashamed or judged for their struggles?
one of the ways to handle that is to help them like get into group therapy,
Yeah.
where they meet people who are going through the same thing like them,
Mm-hmm.
and they don't feel like they are alone. And so when they have that time to go for group therapy, like Alcohol Anonymous or any other group therapy
Mm-hmm.
situation, it will help them not to relapse easily because they
Yeah.
go there and they get the success story of other people, and they also meet people who are struggling with the same thing like them.
Mm-hmm.
Now, just a shift before I get into this one, I've been mentioning a lot of alcohol, but I want to mention a case of a patient who started using kratom. So kratom is sold over the counter, but it has 5 times it's more 5 times more potent than fentanyl,
Mm-hmm.
and it's very expensive.
Mm-hmm.
Like the cheapest will be 109 from my patient's perspective. For that lasts for three $109 lasting for 3 days. But now to this patient, it helped her anxiety, but it's not a treatment for anxiety.
Mm-hmm.
And then what she was experiencing is when she does not have money to buy, she's going through opioid withdrawal, but she doesn't know. She called it anxiety. And when she goes and get the kratom, it goes away. So she thinks that she was managing her anxiety.
Mm-hmm.
Now, when someone comes to you like this who have lost everything because of that substance,
Yeah.
judging them is the most let me not use the word them. I'm like, judging them is the most unfair thing
Thing to
to do.
do. Yes.
Because at that time, the person is in an abstract world. This thing has taken over the opioid receptors of their brain. You
Yep.
have to open your arms. Be patient with them because they don't want to start treatment on Suboxone first. These ones cannot cold turkey.
Mm-mm.
They don't. They can't just stop it abruptly.
Mm-mm.
They have to have it. But now, for you to even get them to understand this, the pathophysiology of that opioid addiction,
Mm-hmm.
you take time with them. It
And I
takes a
I
lot.
also I also like that you refer them for therapy, because most of the time therapy and group therapy as a whole create that safe space for them.
Right.
Feel like they'll meet other people, and in therapy they are reminded that addiction is not their identity.
Mm-hmm.
Addiction is an illness, and shame thrives in the silence of it. But let's talk about it and take away the shame, take away the stigma. We can talk about many other things. We can talk about I have a UTI, I have this, I have, but we make the person who is going through addiction feel so unseen that they have to hide. And I want to ask you, what piece of advice could you give to some healthcare professionals stepping into this field?
The advice I will give is when it comes to addiction, there is a lot of remodeling that takes place in the brain.
Yeah. Oh,
That
yeah.
is this remodeling that
Mm-hmm.
now creates a pathophysiology
Mm-hmm.
that these people are dealing with. And
Mm-hmm.
sometimes they need acute care immediately, and sometimes they may relapse. It's not like they really want to relapse, it is because they have already been a remodeling to their brain.
Mm-hmm.
And the highest thing that every healthcare provider should do out there is provide
Mm-hmm.
compassionate care with positive encouragement. I know there are some patients that are so stubborn that you get to easily get fired by providers. But I want to say there is always a tweak that can happen when you come in with that compassion and therapeutic communication that
Mm-hmm.
takes your patient from the place of guilt to a place of strength. For example, what do you say to a patient who is maybe having to prove like it's in a court system
Mm-hmm.
and has been abusing marijuana and has to be marijuana free, but they keep testing positive for marijuana.
Right.
Each of these addiction has a different pathophysiology.
Mm-hmm.
You have to educate your patient and educate the court system about this marijuana addiction. For example, marijuana is it, our brains all have endocannabinoids.
Yep.
And these
No, and
endocannabinoids secrete
obesity.
marijuana. They have endorphins. These
Mm-hmm.
endorphins secrete morphine when we are in an accident. You don't feel that pain after that crash because your
Mm-hmm.
body gave you morphine. So these things are there. And so you can easily have somebody either on marijuana or morphine test positive while they are sober. So now you will tell them that the quantity of marijuana you got into your system went and triggered that receptor and it produced more for you.
More.
And once it is excited, it keeps
Mm-hmm.
producing and then start demanding for more. So it's going to take a while for you to have a clean lab result.
Mm-hmm.
And then you will also be able to educate the lawyer, educate the court system that this is what is happening. Your
Mm-hmm.
patient is not using, but they should give time. And then when you show that, when you give that, whenever patients have a knowledge of what they are going through, like what you say sometimes when somebody is going through emotional dysregulation and say, name it and name it. When they can be able to name it, Know that it's a process.
You
Know
cut
that they
me
can come
out.
out of it free. They
Name
will do
it.
everything to be free.
Name it. Name it. And you have extensively explained that. Meaning, we go back to say addiction is an illness. It's not us pointing fingers. It's not the person can stop at any time. And someone listening to this now, or someone who will listen to this later and is stuck and feels like they are hopeless, give me one sentence of encouragement that you can give that person who feels like they are just lost.
So just like someone asked in the comment section that how long does it usually take for someone to start seeing real change in recovery?
Mhm,
You help your patients see real change in recovery from the moment that they commit to wanting to change.
mhm,
And the progress of their treatment will depend on how they reward themselves for every little steps they take.
mhm.
For example, someone who is not able, because it is individualized,
Let's
some
just
people
say
can stop.
let's just say a layman in the street who is listening to this and is feeling stuck, is feeling hopeless, is feeling like, okay, I can move forward. What word of encouragement would you offer that person?
I will still tell the person that just the fact that you already are actualizing how you feel is a step
Oh,
towards,
I love that.
and that the fact that you're able to share is already a step towards recovery.
Yes.
And the way forward is that we are going to applaud you for taking this step,
Yes.
and we're going to move to the next step. And
Yes.
every step you make, every progress you make, reward yourself, celebrate yourself, and say, I did it. The moment you become your own coach while others coach you will have a better therapeutic outcome. You will heal
Yeah.
fast. You will recover. It varies from person to person.
Because
Someone can,
sometimes they feel like they are broken beyond repair. And yes, the resilience that someone has going through that may be different. But they feel like they are broken beyond repair. Yes, addiction can be part of your story, but it doesn't define your life or your future. And like she said, every stage, whatever stage you can find yourself in addiction, it is treatable. It is treatable. And if you're not in that stage here, addiction can be preventable. You haven't seen many, many, many patients. Do you have a success story that remind you or that can remind someone out there that recovery is truly possible?
so many success stories, so many. I have seen patients stay sober. I have seen patients celebrate their victories. I've seen
Hmm.
them come in a way like every hope was lost. And
Hmm.
you know, the beauty about healthcare is when you see someone walk through that door like everything
Yes,
finished, my
yes.
basket is empty, and you find them walk with their head lifted up like, I got this. It feels
I
good.
have seen a homeless man cooking meth in the street become a full-time worker, from isolation to reconciling with his wife and kids, watching someone reclaim their lives again after many relapse. It is possible. It is
Right.
truly, truly.
I
Recovery is
used to
truly
say,
possible.
you have this you have some people with straight up success story, you have some people with on and off relapse and all the like. And what I would tell you is failure is not final. And you're not defeated. You did it before.
Yes.
You will do it
Failure
again.
is not final.
You got the power.
It's temporary.
So if pull from your strength and
Mm-hmm.
take this step further, and you will get there. And every individual is different. Every individual is different. Some people have, like for example, I was about to say, some from neurology, the neuroscience has advanced a lot.
Mm-hmm.
So I don't use the word beyond repair any longer in
Absolutely.
healthcare,
Absolutely.
because we now know that there is what we call
Absolutely.
neurogenesis going on in our brain. And one of the things that can help that is a positive environment,
Mm-hmm.
rest, assurance, and you sleep, and your brain can regenerate what you lost.
Mm-hmm.
So, knowing that there is hope and there is light, you can. And then, even if your liver is already damaged and you have alcohol induced cirrhosis, there is medication, there is
There's
treatment.
every year.
All you just need is, you have come a long way and you're not giving up. You've started the fight and you will finish it. You
Yes.
have the victory. You have, pick up the accolades of all your victories. Wear your victory crown. Get ready out there and
Yes.
make it happen, because you can do it. And
Mm-hmm.
so at this note, we're also encouraging, please, if you have a family history of addiction, know your high
Okay.
risk.
All right. That's what I wanted to ask you. What are your final words? Just go ahead.
So know your high risk. Don't start it. It's easy to start, but it will take a lot of fight to
To
break
start.
free.
Right.
Do you really want to create that battlefield?
Right.
If you have not yet gotten into the battle ring, please don't go into it. If you're already there, we are here as providers to help you.
Yes.
You're not alone. We will
Yes.
fight it and you will win.
Yes.
But at the
So,
end of
so
the
there
day,
is
let's do
prevention.
preventive,
Mm-hmm.
and then let's do curative.
Yes.
And as we all come together to fight these enemies that seek after our minds, our souls, and our well being, the society will be whole. And everyone will be able to enjoy and not endure life.
Thank you so much for that. If we listen very well to what she said, if you have not started, you're not missing out on anything. Don't start. Because sometimes starting is easier, but you will not know how it will make you feel. You will not be able to stop. And ask yourself, why do you want to start, by the way? Is it to belong? Is it pressure? What is it? Why do you want to start? So don't start if you have not yet started. Let us prevent it that way. Of course, we can do curative disciplines when that happen, but it's a prevention is better than cure, right? What
Right.
final words do you have to say? Where can our viewers find you? Where can they see you? And all those things.
You can only find me through All Mercy Psychiatry and Integrative Care, because right now I'm a student.
All right, full disclaimer. So yeah, you can find her on Facebook and on other places that we can put. But I just want to say thank you so much for your time. I know how busy you are. Thank you so much for your time. And the audience, those who are watching, those who will watch later, thank you. I hope today's conversation reminds you and me and everyone that addiction and healing are more than medicine. It's about the connection, it's about the courage, it's about the compassion, and it's about the empowerment that Immaculate has said all through this. To our listeners, if you're walking your journey through recovery, know that you're not alone. Healing is possible, even in smaller steps, and we are here with you to celebrate those small steps. Thank you, everyone watching. Thank you so much, Immaculate, sharing so much wisdom with your heart with us today. And the All Mercy team, thank you. I always forget to thank you guys for making this possible. Thank you. Healing is not just about surviving, It's about becoming whole. Until next time, let us stay addiction free, let us stay encouraged, and let us stay well because guess what? Mental health is a journey. Let us continue to take the wheels and ride well together. Bye bye for now.